Hi, my name is Dr. James Vermilyea. A licensed clinical psychologist, board certified in clinical psychology, and I'm the director here at Cognitive Behavior Therapy Associates. I wanted to talk with you a little bit today about anxiety in general. My preceding 3 blogs talked about OCD, which is one type of anxiety. Other types of anxiety include generalized anxiety, in which the person worries a good deal of the time about things that you or I would say, that probably makes sense to worry about. But the difference is that they worry about these things in very short little spurts, and they worry about them a lot, okay? To the point where they might have problems with sleeplessness or might have problems, kind of doing their ordinary daily activities or work. And quality of life really suffers. And again, with any of these anxiety disorders or other things that we'll be talking about, if it doesn't impact your life, it's really nothing to worry about. Okay, it's a question of whether or not it really bothers you. Whether it bothers somebody else is really neither here nor there. If it's not something that bothers you, in general, it doesn't probably need to be treated. So let's move on to another type of anxiety, which is called panic disorder. So panic disorder, what the person feels basically reminds them of a loss of control or the possibility that they're having a heart attack or going crazy. Panic attacks usually come pretty rapidly and can be associated with chest pain, dizziness, feeling of your heart pounding or palpitating, weakness, numbness or tingling around your mouth or extremities, pain or pressure in your chest, difficulty breathing. And you can see why someone who has these symptoms initially might think, oh my goodness, I'm having a heart attack because I've got a pain in my chest, I'm having difficulty breathing, and go to the emergency room. And indeed, if you have those types of symptoms, it would be a good idea to go to the emergency room and make sure that it isn't a heart problem. So that's the medical rule out, as we would say, is to make sure that the person doesn't have some type of endocrine or heart problem. Then, what we do for treatment is very complicated, but basically, to explain it, we try to help the person with anxiety understand different strategies for controlling that. Now, one strategy is, of course, medication, which we don't offer here, but which we can refer people for. And another way is a cognitive behavioral treatment for panic disorder, which has been very well validated over the past 20 years. And all of us here at CBTA can provide that type of panic control treatment. And the latest treatments for panic, are something that we're very cognizant of and familiar with. So the other things that people can have anxieties, or other types of anxieties, for instance, are a person with panic disorder might generate avoidance as a way to try and manage that panic. So if they panicked while they're driving, they might start avoiding driving on the highways, or they might start avoiding crowded spaces, closed spaces, buses, subways, planes, trains, different types of situations in which they feel that or think that the situation is causing the anxiety. In fact, there's nothing about a particular train or bridge or highway or car or crowd that causes anxiety. Anxiety, comes from inside us. And so avoiding it really doesn't solve the problem. It does temporarily, and it's our first natural inclination to do that, but it really doesn't work. So you need, in order to effectively deal with panic, medication can be helpful. Definitely have a consultation regarding whether or not it's a physical problem. And then good cognitive behavior therapy is definitely indicated. Thank you for joining us, and I'll be speaking more on anxiety next time.